Hey there, this is Jordan Chariton with Status Quo. I am talking to you today about my healthcare story from a journalistic perspective. And the top story that comes to mind in terms of human suffering and injustice is the Flint water crisis and cover up, which I've reported on a lot over the last 5 or 6 years. A lot of people don't realize that other parts of the country, particularly Libby, Montana, which is 96% white, when they had a massive health catastrophe, an asbestos crisis that killed hundreds of people, Medicare for all was snuck into Obamacare for the people of Libby, Montana. The people of Flint, Michigan, who were poisoned by their own government, while while they were drinking toxic water, the state government of Michigan, the Republican Governor Rick Snyder, was fully aware that the water was toxic and still allowed them to continue drinking it. When I say them, Flint is majority black, a lot of poor white people as well. And then after it became a national crisis and scandal, they continued efforts to cover it up after the fact. And the media has essentially been in league with the politicians to declare the water fine, even though it's not. I have been in Flint nearly 20 times over 5 or 6 years. And I can tell you, I have sat on porches, front porches with children and prompted them if they could recite the alphabet. And they stop at around the letter D or E when their parents tell me they used to be able to say the whole alphabet. Same thing when I would ask children if they could count to 10 or 20. They stop at 6 or 7. I've spoken with children who clearly have trouble constructing or processing thoughts that did not have those issues before. I've spoken with children and adults who have really major tempers and mood changes and can kind of go from 0 to 60, which is a side effect of heavy metal poisoning and lead poisoning. There's also the fact that, a lot of focus has rightly been put on children and the learning disabilities, behavioral issues, permanent damage. I have spoken over the years with many adults, including adults that when I met them were in their mid 30s, maybe 40s, who have a whole host of issues they never previously had before drinking that water. We're talking about severe autoimmune issues, kidney problems, liver problems, Parkinson's, epilepsy, cancers that they have no family history for and they developed, severe muscle and bone pain. The list goes on and on and on. And then you tack on top of the ailments that they received from the toxic water, a global pandemic, which it wasn't just people over 65 or people with autoimmune issues that were susceptible. Pretty much all of the people of Flint, including children, were more susceptible because their autoimmune and systems were pretty much destroyed. So this is, the term crisis, people become numb to that, but it's still very much a crisis in Flint, not just the actual health problems that these children have and adults. And I know somebody who just died from COVID in Flint. He was about 60 years old. And who knows, if the issues that he had from the water, and he had a lot of issues from the water, contributed to him not being able to fight off COVID. But besides the just unbearable and unfathomable health problems that these people have to live with for the rest of their lives, the bills that have stacked up. I have talked to residents that are literally near bankruptcy trying to afford environmental doctors. Because remember, when you're dealing with heavy metal poisoning, there's also a lot of bacteria that was in this water, waterborne diseases, a waterborne disease known as Legionnaire's disease. A regular internist isn't what you need. You really need specific specialty doctors, environmental doctors, which most insurances do not cover. The residents of Flint got short-term Medicaid expansion for a few years. That's pretty much up. So they don't have Medicare for all to pay for their environmental doctors, their specialty doctors, women who have had, there's been a whole host of miscarriages in women as a result of that water, fertility issues. If you're watching and have struggled with that as a woman, it's not cheap. Fertility doctors and fertility treatments. So they do not have Medicare for all. They don't even have really a permanent expansion of Medicaid, and they have bills stacking up, not just related to their health problems, but Flint is one of the poorest cities in the country. And the government, a lot of people think, oh, what are you talking about, Jordan? The government under Obama sent Flint like $170 billion. No, that money was sent through the Republican governor at the time, Rick Snyder. And my reporting indicates a lot of that money got diverted elsewhere. So if you go talk to the actual people of Flint, how much money they directly got for their health problems, for fixing the water pipes, all those things, not even close to what was earmarked by Congress. And then you have a settlement. You have a settlement that was reached last year, the state of Michigan agreeing to pay over $600 million to the people of Flint. Well, when you calculate that per family, they're getting about a little less than $10,000. It's about the price of a used car. So Medicare for all, we need it for everybody. But at the front of the line should be people through no fault of their own who were poisoned by their government and then basically have been left to die. Because make no mistake, the people of Flint, year by year, and I've been there nearly 20 times, and I will continue going back because this is still a crisis. And if no one else is going to cover it, status quo will. But I will tell you, this is still very much a crisis because people are slowly dying. Real quick, a couple years ago when me and my former partner, Jen Dyes, went to Flint, we knocked on nearly 450 doors working on a story about the state of Michigan cheating on the water testing. And almost every block we went on, if somebody would open, we'd say, hey, we haven't really got people opening their doors at these homes, if they'll be home or if they just wouldn't want to talk. Pretty much almost every block we were told, oh, yeah, that person recently died. So we need Medicare for all. We need Medicare for all people of Flint. We need Medicare for all for everyone. And I will continue to cover the movement for Medicare for all.